The Alldus podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our ServiceNow series, where we interview the best and brightest of the industry to share their story, advice, and views on the exciting world of ServiceNow and digital transformation.
You're listening to the Alldus podcast ServiceNow series. Our guest today is Dianne Kokotoff. Dianne is the Executive Director of Enterprise Solutions and Automation at Wellstar Health System. Dianne, welcome to the show.
Thanks, John Paul. How are you?
I'm doing well, thank you. Excited to have this conversation with you. So we got lots to cover. So let's start with yourself as we do with all of our guests. Could you give us a bit of an overview of your background in technology and what your journey has been from where you got started, some of the roles you've held along the way, and what's led you to where you are today as the Executive Director of Enterprise Solutions for Wellstar?
I call myself a cradle IT person. I started working in IT back in the day when cell phones didn't exist and there was no such thing as laptops, and computers were modules either connected to a mainframe or they were these nice big clunky things that you sat on your desktop. I started in the military, in the Signal Corps, working as really laying wire and setting up telecommunications. From there, I went active duty, and I was an officer in the Signal Corps overseas, again, managing communications, and then eventually left the military and went into the corporate world, right? And I actually started teaching and learning about servers and hardware as an administrator. I was in one of the very first corporate training programs that were actually within the university systems. So now we see this all the time in the college environment, but we didn't have that quite a long time ago. And so I was in one of those first classes, and I actually learned a product called Novell. And there are a few people out there that may still remember it. But from there, my kind of career just blossomed into, I've done corporate training, I have done university training. We lived in Australia for a while, and I was in charge of a huge networked environment with servers and laptops, computers, and basically managed what we call from the wall to the dust. So I managed those systems for a couple of years. And then eventually, when we moved back to the United States, I was able to get into a company. It's a very large financial organization. And I worked there for years, working my way up through different areas. I did application development and I did service support. But eventually, I was looking for a product to support contract management, and I came across this very new product called ServiceNow. And yes, and I investigated it and wrote business cases and decided, you know what, wait a minute, I'm also in charge of service management. Why don't I move from an IBM tool to this product? So I actually was the person who got it into that company, ServiceNow into that company. And I have been a ServiceNow enthusiast, I say, for forever, since the beginning of ServiceNow. And I have loved watching the company grow. And I built it up in my other company. And then I left that company and moved over to Wellstar, where I became the platform owner of ServiceNow. And we started off small and have grown to quite a large platform here in Wellstar.
Dianne, thank you so much for that background. I think it's super important to share in such detail because it talks about your exposure to different elements of the IT infrastructure and then how it evolved into more modern technology stack and how you progressed into a leadership position. We could probably do a whole episode on the work that you did at your previous company, but in the interest of time and keeping it focused on the most important piece, let's talk about the here and now. before we talk about your role in more detail, tell us a little bit about Wellstar Health System, who you are, what you do, and who Wellstar serves.
So, Wellstar has a mission to enhance the health and well being of every person we serve. And we have actually, I think we're now at 38,000 employees, and we serve 1 in every 6 people within Georgia. We are a nonprofit organization, and we do provide the largest uncompensated care in the state of Georgia. We have been a ServiceNow customer and healthcare, right? So we have 11 hospitals, and we have been a ServiceNow customer since 2017. The idea, of course, started as we wanted to replace an older project management tool. And from there, when I was brought in, they had ServiceNow for about 9 months and nobody was using it. And actually, nobody liked the tool. And I was like, okay, we need to fix that. So I went in, formalized our processes under the ITIL umbrella, and then started building out ServiceNow.
Amazing. And that's such an interesting starting point to come into an environment where a platform like ServiceNow is already in there, but it hasn't got the traction that people would expect, and you've got to change the perception through evidence. How did you go about doing that? What were the steps that you took, and how did you convince leadership that ServiceNow as a platform is actually useful? And I know you've got some good examples to give me at a later point of expansion of the platform's capabilities, but the biggest challenge for you at the starting point was, I got to show these people that this is a good tool. What was that
Yes.
like?
Yeah, very interesting. So again, I came into the environment and there were a few people using it, but for the most part, everybody said it doesn't do what I want. And so the very first thing I looked at was, okay, let's look at the metrics. So who's using it? What are we using it for? And what do we have? And what I found was that there was no consistency to the data. So for those of us in the IT world, we understand if your data is not good, you're going to blame it on the software. It's inevitable. But what we really needed to do was take a big step back and say, why is the data so bad? It's not the tool's fault, right? It's the human behind it. So what I realized is we didn't have any processes, that we did not have control and standardization. So the very first thing I did was I pulled people together and said, we have to come up with a process. So we started at the most basic fundamental, which is interesting because I'm going to say we started at incident, but I did say at the very beginning, the reason why they put ServiceNow in was project management. But after talking with the project managers at the time, they were like, we're just using Excel right now. And I said, you know what? I said, I think that it's okay for you to use Excel. And what we will do is we are going to look at changing things so that we can go ahead and modify the work that you're doing in a more strategic manner when you're ready. So focused on the ITIL data, we focused on the ITIL processes, and we got incident, problem, change, and request under control. That took about a year. Once we did that and the data started becoming good, then I was able to start attacking the project management side of the house and saying, okay, let's redo this. What do we need to do? But I think that my ability to keep expanding was as we were careful about what we did and how we did it to ensure that there was a process behind it and a process owner. That enabled us to move as fast as what we have been able to do and as much. When I look back over the last 7.5 years and I know where we started and now where we are, it actually sometimes blows my own mind because I'm like, wow, we have really, really expanded this platform immensely, but it's been through a very, very targeted, very precise way of making sure that as we add it, we have buy-in, we have the people that who are going to use it, we involve them in the project. We make sure that everybody's trained and they understand the data, right? And they understand how to use the data, because reporting out is very important that a lot of people tend to forget about.
Yeah. It sounds so simple, but easier said than done. And
Easier said than done.
we speak to so many companies, so many partners who can have success in one area of the platform, but then to get at a broader scale, each module is almost like a different business unit. The fact that you guys have been able to do it so well, so consistently is really a testament to what you and your team have done. To get a sense of scale of ServiceNow adoption across Wellstar, can you help set the stage just so we can visualize just how far you've come over that 7+ years?
So when we started, we owned ITBM, which is now SPM. It was not being utilized. We owned the ITSM, which was being utilized, but intermittently. They had the asset management, but it wasn't implemented. They had GRC, but it hadn't been implemented. And so those were the 4 products that they had. And so the first thing I did is evaluated and said, let's look at the ITSM. That's pretty much the core of ServiceNow. Let's fix that. Since then, we have expanded the security to include SIR and VR. We expanded the ITSM. We now have the Pro Plus. We have the SPM Pro. We have asset management. We have software asset management, and all of those are implemented fully. We have MoveWorks. That was one of the first things that I added before MoveWorks was part of ServiceNow. I feel like we have the EMR help system. We have the health and safety that we use for employee health. A lot.
Yeah.
You are listening to the Alldus podcast. When you're looking to scale your team, or if you are interested in showcasing your company in a future episode, reach out today. Or if you're in the market for a new role, visit our website to view open positions, www.alldus.com.
With each module, it's new set of challenges, new set of objectives, new set of expectations, and you obviously have a formula that works. So when you and the leadership team are assessing new capabilities, new functionality from ServiceNow, whether it's MoveWorks or Now Assist or the conversations about AI adoption more broadly, what is that like for you and the leadership team? How do you assess when, where, and how for each new tool or product that's available, not just from ServiceNow, but agentic tools? Is ServiceNow always the right one? How do you process when and where?
So I'm going to break that up into 2 parts. So the first part is, how do we determine a new tool? And I can't speak for all of the areas because we do some different methodologies on the clinical side. But on the shared services side and the products underneath me, I make sure that the very first thing I do is I have a business stakeholder that is going to approve it, right? So they come to me with a problem. I say, okay, let's evaluate. I decide, okay, after talking to a couple of people and researching, we're like, we think that this would be the best tool for you. And these are the reasons why. But here are the other things we looked at. And this is the reasons why we did not choose them. Now, if it's a huge platform, we do a whole RFP and things like that.
Of course.
But for simpler things, I can usually get the business stakeholder to say, okay, yes, I agree. I understand. And this is how they match your requirements. So once we get the stakeholder buy-in, we actually do something a little unique in that the stakeholder must pay for the first year and the implementation. So they have to come up with the money. And I think that lends a little bit different view because they now have a stake, right?
Yeah.
they are paying something. So once we get all of that agreed upon and we decide on what vendor is going to help us implement, if we need a vendor to implement, and we take it from there, and then we start implementing it. And we keep the stakeholder completely informed all the time. And we make the stakeholders team do the testing. So that's the other thing is, so they're lockstep with us every step of the way. And I think that has been probably one of the keys to our success because they were involved in it. It's not, okay, here, I've done everything for you and I've handed it to you. And then they
Yeah.
can turn around and go, well, that's not really what I wanted.
I want to
Yes.
spend a little bit of time now towards the end just talking about the team that you work with and how you approach the ongoing maintenance of the platform. What's the involvement? How do you collaborate with your internal team versus some strategic partners? And when you look at the roadmap ahead, if there's any new functionality implementations expected, how do you approach it?
I say our team is lean and mean. We have 12 people
Wow.
supporting a very, very large platform. And it consists of 3 senior developers, a developer, some admins. We do have an architect, we do have a BA, and we do have a testing team. So I've tried to balance out all of the different areas of support, to make sure that as we implement, we're implementing something that is secure and will integrate well. So our architect stays busy, very busy. So that is our team. And we do Agile, just like I'm sure a lot of other ServiceNow teams do. We actually use the ServiceNow Agile. We don't use Jira. And so we try to keep everything within the platform. And that team works very well. I have a fantastic director, Larry Ross. He is phenomenal. So anybody listening to this podcast, you may not have him.
Shout out to Larry. Hands off, everyone.
Hands off. But between that team, we really work well together. And then, so when we're looking at connecting with the stakeholders, as I said before, it's definitely a conversation that we are having to make sure that stakeholder is all in before I even reach out and say, okay, now I will ask for the order form. So we truly try hard to make sure we've got that.
When you look at everything you've accomplished and you go, wow, we did so much, and you've broken down why and how you've been able to do that. Speaking to you on this podcast, it's clear that you still have the passion and enthusiasm for what you do. So when you look at the road ahead, particularly the next 12 to 18 months, because in our world of technology, it's hard to plan too far out. You just never know what's coming. But when you look at the road ahead, what are you excited about? What are you looking forward to doing, whether it's a new piece of tech or new impact for different areas of Wellstar? What's exciting you about the next 12 to 18 months?
So 2 things. From the ServiceNow side, we are actually branching off into areas of the module that are very non-traditional for a healthcare organization. We're looking at not only facilities, but the legal module. We're taking that legal from also a security perspective, but you don't typically see that module in the healthcare space. So for me and for our team, that's pretty exciting because I feel like we are breaking the barriers of what is traditionally seen as a ServiceNow platform setup for a healthcare organization. So I think that is exciting. The other side of my world, which is the automation side, we're including ServiceNow in that, which is the development of agents. So we use a couple of different products, and we are hoping to expand the use of agents to try and fill the gap of all of the new work that's coming in and all of the extended modules that we're looking at without changing the headcount. Because we are no different from practically everybody else in the world these days, where you're looking at how do you reduce the headcount. And rather than reduce the headcount, how can I fill the gap? And so we're looking at agents. That's our newest piece, and we're really excited about that.
I love that. Dianne, thank you so much for coming on today and talking to us. It was an absolute pleasure both to learn about your own background, your journey from starting hands-on with technology, hardware, right to an impressive executive director position, and more importantly, the achievements and the work that you and your team have been able to accomplish at Wellstar since you've been there is remarkable. It's a great case study and example for how you go about building scalable modern technology and the impact that ServiceNow can have for an organization when it's approached in the right way. So congratulations for all that you've done, and more importantly, excited to see what you and your team continue to do for Wellstar. I look forward to having you back on the podcast again in the near future.
Thank you so much. It's been a pleasure.
Thanks for listening to this episode of the Alldus podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.